do run a great program. There's 4 of us, there's 4 nurses on the program. We see nearly 6,000 people a year, which is a lot of people. We do 200 events. It's a lot of work. It's work that we really enjoy to do, and we believe that what we do is unique. There's no one else that we know of in Australia that do what we do. And it's a very valued program. The community members that we come across in our pre and post evaluation forms, they absolutely just love us. They really appreciate us going to these small towns.
I think it's really important that people are able to have a say, and so the community advisory group that I've been involved with, I'm just astounded at how seriously we're taken by the board. It's got a really diverse group of people from different geographical regions and backgrounds, but we all, I think, work really well together, and what's really wonderful is the board takes note of what we're saying and has put considerable funds up in a number of areas to follow some of the areas that we've suggested that we think we'd like to see some directions taken.
The PHN have contracted us to cover 50 towns, and each town we have to do 4 events. These towns only have 2,000 people and less. So some of these towns might only have a school, some of them might only have a hall. So what do? The health needs assessment, it dictates what is needed in that town. So there might be a high percentage of obesity, or high percentage of mental health, or high percentage of smoking, or something like that. So that dictates really what we need to be doing. Talk to the people to find out what they want. Ask them what they want. You know your town, you know the people. What would you like us to do? For an example, Kelvin only has a hall. They want a skin cancer check, so we go to the hall, we do that. They wanted something on depression, so we organise something on depression, for an example. So it is community driven, but it's health prevention and health promotion.
It's just wonderful that the Primary Health Network does a needs assessment, particularly for little communities like this one here at Summit and where we are. How else do you find out what really is required? It's all about providing what is really needed rather than what other people think that community needs. So for a little community like Summit, and you've got lots of people who often quite reticent to get involved in formal sort of health institutions or whatever, and so we know how important education is in communities like this, and to have people come out and work with young people to really get them on the path earlier on and be aware of what things they need to do to look after themselves, to live a healthier lifestyle, and then hopefully take that demand off the health institutions later on.
Many of the schools that we see don't get any health education support whatsoever, so it's often us that ring up and say, can we come and do this, this and this, and the schools will jump on it and book us every year, so yeah, it's great. Kids love it, they're so receptive. They all hands up want to tell me a million stories about the dentist. Kids that haven't been to the dentist are made feel better. We show some videos. Yeah, they love it.
We provide a service that they would never access these health services anywhere else. We come to them. So we're unique, that's what we do. That's our job. I think it's a really valuable service.